To introduce the next speaker. He already starts to share his screen. It's Paul Dijkstra. He's a specialist sports and exercise physician, originally from the United Kingdom. He earned his marks in track and field, where he was the team physician of Team GB for a while. And currently he's the director of education at the Aspetar hospital in Qatar. So Paul, the floor is all yours.
Thank you very much, Everett, Gino. Can you hear me? Is this clear? Yeah, good.
Yes.
Thank you very much for inviting me to be part of this webinar, COVID-19 and the elite athletes. This is obviously a hugely tragic and I think terribly challenging time for many people around the world who've lost loved ones, who maybe have been ill themselves and are suffering from the devastating consequences of this pandemic. So can I just say that when we talked this morning about the impact of the pandemic on the elite athlete, it is so important to acknowledge the unimaginable suffering and hardship of many individuals and families around the world, single mothers of young children queuing for food, old people maybe sitting alone in their small apartments, the homeless, the oppressed. We cannot talk about the elite athlete and elite sport without acknowledging the real heroes and the real medalists of this pandemic. So in this context, the frontline health workers and their support staff, shall I say that we salute you, and also those who've suffered so much hardship, hunger, and horrific discrimination, many still managing to contribute and conquer despite of that. So just as a short introduction. So I'm going to cover in this talk the infodemic. I'm going to tell you a little bit about what the infodemic is, how athletes, coaches, and sports medicine clinicians can cope with this infodemic. I'll tell you what we do at Aspetar to try and help people, stakeholders, to cope with the infodemic, the so-called Aspetar COVID-19 Evidence for Athletes service. And then I'll end with one or two slides asking you to consider your active role in fighting the COVID-19 infodemic. So the World Health Organization's Director General, Dr. Tedros Ghebreyesus, said the following at a World Health Organization Security Conference in Munich on the 15th of February. We're not just fighting an epidemic, we're fighting an infodemic. Fake news spreads faster and more easily than this virus, and it is just as dangerous. And this is profound. He continued to say that in our fractured and divided world, health is one of the few areas in which international cooperation offers the opportunity for countries to work together for a common cause. And can I also say that not only the health world, but I think the world of the elite athlete offers the opportunity to collaborate and to work together. This is a time for facts and not fear. This is a time for rationality and not rumors. And it's a time for solidarity and not stigma. So fake news, I like this definition on the Wikipedia page, also known as junk news or pseudo news or alternative facts or hoax news, is a form of news consisting of deliberate disinformation or hoaxes spread via the traditional news media, print, broadcast, or online social media, as we will see now. And there's lots of examples. This is just a few. The so-called 5G antenna causing the virus, steam to help you to cope with the virus or to treat the virus, and fake news presented as if coming from the Johns Hopkins University with the Johns Hopkins appropriate response to deal with that fake news. But fake news is also political. Being it is the fake tan photo fake news. I won't discuss bleach today, but more about the hydroxychloroquine, the drug that Donald Trump said he was taking as a precaution later. So how to deal with fake news? And there are perhaps four different ways that I just quickly want to touch on. Fact checking and correction or debunking is one. And Twitter recently started to do that with a few of President Donald Trump's tweets, with an exclamation mark, get the facts about what's been tweeted about. And he's not very happy. He wasn't very happy about that In fact, he blasted Twitter after the platform disputed the accuracy of 2 of his tweets, saying that Twitter is completely stifling free speech, and I, as the president, will not allow it to happen. So debunking is not always easy, but I think it's crucial. Another way is a vaccine. So you'll be surprised to hear there's a vaccine that can help you to cope with fake news. Not really. It's psychological inoculation, or so-called pre-bunking. And this is a game at this website, getbadnews.com. And you can play that yourself, or give it to your athletes, and especially to children. And this will help all of us to recognize fake news when we see it. Then there are subtle prompts encouraging deliberation, and finally delivering accurate information. And this is exactly where Aspetar's service is aimed at. So we want to deliver accurate information through our COVID-19 evidence for athletes service on our website. And we started this service towards the end of March already. So we're now in the 3rd month of delivering this service on our website, with the aim to provide evidence-based information and guidance on the COVID-19 pandemic to athletes and those involved in athlete healthcare. Now, for those of you who don't know, Aspetar is a hospital, a sports and orthopedic hospital in Qatar in the Middle East. And we are one of 11 International Olympic Committee research centers on injury and illness prevention and athlete health protection. Aspetar has a website, a Facebook account, and a Twitter account with 66,000 followers. So a really good setup to share evidence-based information with not only the Qatar population or the Qatar athlete population, but also the wider world. And this is what our service on the website looks like. We've had 12,000 visits from 100 different countries over the last 2 months. And we divide our service into different sections, and I'll quickly go through those sections now. I have to say the service is in English, but also fully translated in all aspects in Arabic as well. So there's a mirroring website in Arabic. On the front page is this infographic, and you can download this infographic, a PDF of this, and then follow the different links to each section that might apply to you, from the athlete's question section right down to a repository of local international news. Now, we can't do this without an evidence team. So we have a number of individuals working on this really big project. It started off with a small team and then grew. I don't want to single out individuals, but maybe Dr. Sophie Neelis, Fatin Smiley, Marco Cardinali, and maybe Professor Mike Clark of Evidence Aid, our marketing team and the IT team here at Aspetar, and I'll tell you a little bit more about that later. We also have 5 IOC research centers involved, either endorsing or actively involved in reviewing material or perhaps sharing new material. We also involve students, so the medical students from Weill Cornell Medicine in Qatar. They have a sports medicine and physical medicine rehabilitation interest group led by medical student Toka Afifi, and providing excellent contribution to this service. And then we're endorsed by a number of institutions, but most important, we have athletes and coaches on our team. So all the material, English and Arabic, are moderated by athletes and coaches as well. Perhaps the most important part of this service is this section, the so-called athletes question section. So we get questions from athletes, and then we give these questions to the evidence team. And the evidence team look at best evidence from different resources and provide the athletes with easy, readable answers to these different questions. I'm not going to go through all the questions. There are 31 already. And here's just a brief look at some of those questions that athletes asked us and that we've answered. There's also excellent infographics by our marketing team on the site that you can download and share and use if you want. So is the virus flying in the air? What does the virus look like and how does it transmit? How do I protect myself in addition to washing my hands? Can I boost my immune system? And the question and the answer there is no, you cannot boost your immunity. You can protect or maintain your immunity perhaps. And then something on nutrition and supplements. I just want to say a few words on masks. Should I wear a mask and gloves to protect me and others from COVID-19? And obviously, the answer to this question will vary depending on where you are in the world. In Qatar, it's compulsory to wear a mask when you leave your house. And now you can exercise without a mask if you're not in a group and if you maintain a 3-meter distance in Qatar. And from the 15th of June, since it was announced yesterday, you must wear a mask when you go on public transport in the UK. So when you are, you or people close to you have symptoms of COVID-19, you must also wear a mask at home, is the advice. And wearing gloves is not recommended. And I want to really highlight the research done by Professor Chris Greenhalgh at the University of Oxford. She's published 2 papers, and this is her slogan: cover your face in a public space. It's evidence-based. It makes us safe. And I cannot agree more. So this is a paper published in the BMJ maybe 6 weeks ago. And she followed by this paper, face coverings for the public, laying straw men to rest. And these are 4 key points. The precautionary principle states we should sometimes act without definitive evidence, just in case. Whether masks will reduce transmission of COVID-19 in the general public is contested. Even limited protection could prevent some transmission of COVID-19 and save lives, arguably from 17 to 18% to 3%. And because COVID-19 is such a serious threat, wearing masks in public should be advised. We also translate our athlete questions and answers into maybe 15, 16 different languages. And we use the excellent Open Science Framework platform to share these translations with users. And if you follow that link on the infographic, it will take you to the page on Open Science Framework where you can find all the translations. There's a section on education material, infographics, a video library, and growing podcast library. For instance, take care of your own health and protect others. These are wellness tips. So the first one, live smart, and the different maybe pieces of advice there on living smart. You can scan the code and watch a relevant video on this infographic. And it's also available in Arabic. Live smart, but also eat smart, with, again, 5 pointers there to how you can take care of your own health and protect others by eating smart. And train smart. Do not exercise in groups. The virus can be transmitted via respiratory droplets. That might be relevant depending on where you are and what type of sport you do. And exercise at home might be relevant for our athletes, and exercising for too long at a much higher intensity than usual can compromise your immune system. There's also this infographic on how to deal with stress from the coronavirus pandemic. And if you look at number 6 there, stay informed and avoid fake news. So this is the topic of my talk. But also take time off, realize that the whole world is dealing with this pandemic maybe, and keep a routine, etc. Now, Martin alluded to this. And when I did just typed in COVID-19 in PubMed, 18,167 results came up, of which 18,161 are in 2020. So licensed healthcare practitioners or sports medicine clinicians working with athletes are faced with a tsunami of evidence, shall we say, or potential evidence in many aspects. Now, getting back to the hydroxychloroquine, and I want to show you this. So on the 25th of May, The Guardian published this article: World Health Organization halts hydroxychloroquine trial for coronavirus amid safety fears. And it was based on this paper that was published in The Lancet not long ago. However, 2 days ago, this article was published in The Guardian about Surgisphere. Governments and WHO changed COVID-19 policy based on suspect data from a tiny US company. Surgisphere, whose employees appeared to include a science fiction writer and adult content model, provided a database behind the Lancet and the New England Journal of Medicine's hydroxychloroquine studies. And there's the Surgisphere's website. If you click on their website, and you can read their response to our article featured in the Lancet. Now, this was on the 3rd of June. And this is the other paper that this article alluded to, the cardiovascular disease, drug therapy and mortality in COVID-19, published in the New England Journal of Medicine. And both these papers were retracted yesterday because all the authors were not granted access to the raw data, and the raw data could not be made available to a third-party auditor. They were unable to validate the primary data sources underlying their article. And if you go to retracted coronavirus papers on this excellent website, retractionwatch.com, there it is, number 14 and 15. These two papers retracted yesterday. So it's key that we should know about this, and that we should perhaps regularly visit this website to make sure that what we use to create evidence is reputable evidence, especially now with the rapid research, pre-publication, peer review, and final publication process. It is vital to know of Retraction Watch, specifically relevant to COVID-19. So on our website, we provide, under the scientific papers heading, resources for clinicians and for researchers. So these are repositories or rapid reviews of scientific evidence on COVID-19, and I'll quickly go through these, but there's also links to the Lancet, to Nature, and to the New England Journal of Medicine's website. There's a section on general papers, and there's a section on sports papers, on masks, etc., in this under this heading. So a number of excellent sites are available for us to visit and to look at evidence, to look for evidence. This is one, Guidelines International Network's website, and they have an excellent COVID-19 service, dividing their service up into sections on rapid reviews with links to Cochrane, McMaster, etc. Evidence maps, databases of studies, journals, preprints, registries of studies in progress, ongoing studies, and also other evidence resources. This is Evidence Aid, and at the bottom left is Professor Mike Clark, the Research Director of Evidence Aid. And I'm mentioning him because he was instrumental in helping us to set up the service, and he is still a mentor and guiding us through this. There, just above him is Claire Allen, the Program Operations Manager, and at the top is Ben Taylor, the Chief Executive Officer of Evidence Aid. Evidence Aid is championing evidence-based humanitarian action, and it was established in 2004 after the devastating tsunami. And if you visit their webpage, this is what you'll see. This evidence collection contains plain language summaries of high quality research, which are available in English and translated into French, Spanish, Portuguese, Arabic, and Chinese under different headings. And perhaps if you then click on, let's say, the distance traveled by respiratory droplets, this is the type of evidence summary that you will see. Distance traveled by respiratory droplets, you'll see that the search was done before the 31st of March, and that they included 10 studies in this, 5 of which included experiments with human subjects, and then that is what they found, and there's a disclaimer, etc. This is the Cochrane Rapid Reviews website with rapid reviews on COVID-19 service. And here they have 3 main objectives: to list reviews that are underway in Cochrane and elsewhere to help frontline medical staff, policymakers, and consumers with answers they need. Very important second point, to reduce duplication of effort by showing researchers where reviews are being addressed by other teams, and maintaining a list of questions submitted by stakeholders. And equally important, finally, to support the production of high quality rapid reviews by providing protocol and review templates and methods, methods guidance. Another excellent service is the COVID-End by McMaster University, the COVID-19 Evidence Network to support decision making, with their link there. An excellent website and service. And this is what you see when you click on the link. They provide resources to support decision makers. They provide resources to support researchers. And they also have 7 working groups working to achieve and document quick wins, so to say, and to establish processes to achieve and document longer term wins. This is the Epistemonicos Foundation, an excellent website worth visiting and looking through. For instance, questions raised: do stem cells have a role in treatment of COVID-19? And then you can click on that link and learn more about the evidence. There, right at the bottom right, is chloroquine and hydroxychloroquine. Are they effective against COVID-19? This is the US Department of Veterans Affairs Evidence Synthesis Program, another excellent resource. And the Center for Evidence-Based Medicine at the University of Oxford, COVID-19 Evidence Service. This is a rapid evidence reviews, data analysis, and thought-provoking writing relating to the coronavirus pandemic, and it's updated regularly and definitely worth a visit. We also provide our service users with a repository of local and international news, and let's say reputable news, relevant to athletes and also to the COVID-19 pandemic. And we provide this service on the Center for Open Science's website, so the Open Science Framework website. And this is regularly updated. We started this on the 29th of February. And this is what you'll see when you get to that page: Open Access COVID-19 Qatar and World News Repository and case numbers. You can see what the recent activity was in this sphere, who did what, so it's transparent. Everybody can see who updated it, how it was updated, when it was updated. And then if you click on that link, the PDF COVID-19 news, this is what you'll get. So at the moment, it's already close to 100 pages of reputable news and COVID-19 numbers relevant to Qatar and the world. On the left-hand side, Qatar, and on the right-hand side, the world. And if you look there at the top left side, you'll see we started on the 29th of February, when Qatar had its first positive COVID-19 case, and when the US confirmed its first known death of coronavirus. So really interesting to look back and see what was in the news and look at the numbers on each day, and then updated until yesterday, the 4th of June. And you'll see there, governments and WHO changed COVID-19 policy based on suspect data from tiny US company. So we have that news article there ready in our repository for those who visit this site. I'm ending with this, and I want to ask the question: should we be quiet and indifferent and just allow fake news and maybe half-truths and bad science to continue? And I want to say no. And I want to agree with Rachel Clark in this brilliant article that she published in The Guardian. She said the true metric of success in a pandemic is simple. It is the overall number of deaths prevented. And that's also true maybe in the athlete context, the overall number of illnesses and deaths prevented in the elite athlete context. The point of our response to coronavirus is not to flatten curves or ramp up health headlines, protect the NHS, or invent mathematically nonsensical equations. It is the prevention of unnecessary dying. And the 1986 Nobel Peace Prize laureate Elie Wiesel said the following: we cannot be indifferent. The opposite of love is not hate, it's indifference. The opposite of art is not ugliness, it's indifference. The opposite of faith is not hearsay, it's indifference. And the opposite of life is not death, it is indifference. So this was a whirlwind through the COVID-19 infodemic. It is real. I hope I gave you some tools to try and cope with it, debunking, pre-bunking, and accurate information. I took you through a whirlwind tour of our Aspetar COVID-19 Evidence for Athletes service. And I emphasized the fact that we all have an active role to play. We simply cannot be indifferent, even if it is political. And can I just thank the team again? My team, education team at Aspetar, the sports medicine department at Aspetar, the marketing department at Aspetar, the IT department, Aspire Zone Foundation, all our collaborators from the different IOC research centers, the students, the athletes, and their names are there. I can't name them all. A huge thank you. This is not possible without a massive team effort.